Hello, healthy beings, welcome back to my channel. I'm Natasha, and today I'll be talking about diabetes mellitus. Guys, the disease. This disease is like prevalent in almost all houses in India, and which we guys think is normal or minor, which guys seriously it's not, because it comes with a hell lot of complications which I will be talking about in my later videos, so you need to stay tuned for that. And in this video I'll be providing you a detailed information about diabetes mellitus. I will be explaining only two variants of it in this video, and about its management and drug therapy I will be covering that part in the next video. So stay tuned guys, and don't forget to like, share or subscribe. And without further ado, let's begin. Diabetes mellitus. It is a chronic multisystem disease related to abnormal insulin production, impaired insulin utilization, or both. Diabetes mellitus is a serious health problem throughout the world, and its prevalence is rapidly increasing. Now, talking about its etiology, it is always seen that it is related to genetics, autoimmunity, and environmental factors. Diabetes mellitus is a major factor causing heart disease and stroke. Regardless of its cause, it is seen that absent or insufficient supply of insulin gives rise to disorders of metabolism of glucose, which further leads to diabetes mellitus. The American Diabetes Association recognized 4 different classes of diabetes: type 1 diabetes mellitus, type 2 diabetes mellitus, gestational diabetes, etiologically caused diabetes. Now, talking about normal insulin metabolism, insulin is a hormone produced by the beta cells in the islets of Langerhans of pancreas. Under normal condition, insulin is continuously released into the bloodstream in small pulsatile increments, with increased release when food is ingested. Insulin lowers blood glucose and facilitates a stable normal glucose range of approximately 70 to 120 mg per dl. Insulin promotes glucose transport from the bloodstream across the cell membrane to the cytoplasm of the cell. The rise in plasma insulin after a meal stimulates storage of glucose as glycogen in liver and muscles, inhibits gluconeogenesis, enhances fat deposition of adipose tissue, and increases protein synthesis. For this reason, insulin is an anabolic or storage hormone. The fall in insulin level during normal overnight fasting facilitates the release of stored glucose from the liver, protein from muscle, and fat from adipose tissue. Skeletal muscle and adipose tissue have specific receptors for insulin and are considered insulin-dependent tissues. Insulin is required to unlock these receptor sites, allowing the transport of glucose into the cells to be used for energy. Other tissues like brain, liver, blood cells do not directly depend on insulin for glucose transport, but do require an adequate glucose supply for normal function. Although liver cells are not considered insulin-dependent tissues, insulin receptor sites on the liver facilitate hepatic uptake of glucose and its conversion to glycogen. Other hormones like glucagon, epinephrine, growth hormone, and cortisol work to oppose the effects of insulin and are referred to as counter-regulatory hormones. These hormones increase blood glucose levels by stimulating glucose production and output by the liver and by decreasing the movement of glucose into the cells. The counter-regulatory hormones and insulin usually maintain blood glucose levels within the normal range of regulating the release of glucose for energy during food intake and periods of fasting. Now talking about type 1 diabetes mellitus, it is known as juvenile onset diabetes or insulin dependent diabetes. It generally affects people under 40 years of age or under 20 years of age. Etiologically, it is seen that it is caused due to immune mediated disease. It is an immune mediated disease caused by autoimmune destruction of the pancreatic B cells, the site of insulin production. This eventually results in a total absence of insulin production. Autoantibodies to the islet cells cause reduction of 80 to 90% of normal function before hyperglycemia and other manifestations occur. Manifestations include ketoacidosis, gradual or sudden weight loss, polydipsia, polyphagia, and polyuria. Now talking about type 2 diabetes mellitus, it is known as adult onset diabetes or non-insulin dependent diabetes. By far the most prevalent type of diabetes, 90 to 95% of patients. The risk factors are obesity, family history of type 2 diabetes, and being an old age person. The clinical manifestations are okay, fine, let's talk about etiology first. In type 2 diabetes, the pancreas usually continues to produce some endogenous insulin. Endogenous as in self-made. However, the insulin that is produced is either insufficient for the needs of the body or is poorly used by the tissues. The presence of endogenous insulin is a major distinction between type 1 and type 2 diabetes. Clinical manifestations for type 2 diabetes mellitus are almost like non-specific, but the patient definitely shows fatigue, recurrent infections, recurrent vaginal yeast or candidal infections, the patient will show visual changes and prolonged wound healing. So stay tuned for the next video where I will be telling you about the drug therapy and its management. Thank you for today. Have a nice day. Don't forget to like, share, and subscribe.